Beta-hydroxybutyrate has a direct effect on the assembly of a genetic regulatory entity called the NLRP3 inflammasome. And this is like a regulating gene expression control that alters multiple downstream genes in the inflammatory cascade. And so this explains the dramatic anti-inflammatory effects that we see once people are effectively keto-adapted.
Beta-hydroxybutyrate BHB, a ketone produced by the liver from fatty acids. It blocks the NLRP3 inflammasome-mediated inflammatory disease. When keto-adapted, or fat-adapted, we severely reduce chronic inflammation.
In addition, because the beta-hydroxybutyrate alters the epigenetic effect on histone deacetylases and reduces reactive oxygen species, when you have beta-hydroxybutyrate present, it reduces the impact of reactive oxygen species on membrane polyunsaturated fatty acids, which get turned into pro-inflammatory agents called isoprostanes.
Histone deacetylase, an enzyme that removes the acetyl group from histone proteins on DNA, allowing the histones to wrap the DNA more tightly. BHB alters the epigenetic effect on histone deacetylases and reduces reactive oxygen species, ROS, thus reducing their effect on membrane polyunsaturated fatty acids before they turn into pro-inflammatory isoprostanes.
Our reactive oxygen species just attack a membrane. There's no enzyme involved. And when it attacks the membrane and damages the polyunsaturated lipid, it produces pro-inflammatory compounds.
In summary, BHB presence in cells reduces inflammation.
It gives us a very credible mechanism for why we see dramatic effects on type 2 diabetes when we counsel patients and get them to follow a well-formulated ketogenic diet.
It helps us understand why people on a well-formulated ketogenic diet have dramatic positive effects on type 2 diabetes.
This concept of inflammation as having a role in diabetes is a new concept, but we're making progress. The first paper that I can identify that was in a mainstream journal that said, look, this is important, was the first of these papers by Bedonath and Schnolsen that was published in 2011. This is a Swiss group, and this was looked upon with great askance. But those guys are pioneers. Jerry Olewski's group, these are leaders, these are thought leaders in diabetology. And when they publish a paper in Journal of Clinical Investigation that says inflammatory mechanisms linking obesity and metabolic disease, when the mainstream says this could be important, and they put it in a top-ranked medical journal, then you know we're making progress. Probably one of the most important papers I was involved with was a study that was done primarily by Jeff Volek's group and published this back in 2008. This was a randomized controlled trial of people with metabolic syndrome, not really severe metabolic syndrome. One dietary intervention was a well-formulated ketogenic diet. Right-hand side, LCD, 20+% protein, and about 12% carbs. So the other arm got randomized to a balanced diet, a low-fat diet, where they were told to only eat 1,500 calories per day. One was a restricted diet, one was eaten to satiety. On the low-fat diet, they only ate 12 grams of saturated fat per day. On the high-fat diet, they were eating 36 grams of saturated fat per day. They were eating a lot more fat than that. This wasn't high saturated fat in proportion, but they were eating 3 times as much saturated fat on the low-carbohydrate diet arm. As we usually see, when you do a well-formulated ketogenic diet right, people on the ketogenic diet lost twice as much weight as the people on the low-fat, high-carb diet.
In a 2008 study, which was randomized controlled trial of low-fat diet, LFD, which only ate 12 grams saturated fat per day, versus a keto, LCD diet, which ate 36 grams of saturated fat per day. The results? The low-carb diet, keto, group lost twice as much fat as the LFD group. Stated and summarized, easy to share with loved ones. The description below the title for this video has these summary points.